think one of the things that most people don't understand is that tooth decay starts out small. It doesn't just appear overnight into this massive cavity. We'd like to see our patients every 6 months. And the reason being is that's just a good interval to where if changes are going to take place, we're going to pick up on them. Our molars that we have in our mouths have deep grooves and pits in them, and sometimes those pits are soft at the bottom, and that area is usually decay. If you've ever had a dentist examine with that probe, or we call it an explorer, and we go across the top of the tooth, we're checking to see if there are soft spots. We a lot of times will verify that with x-rays. You may also ask, why does a dentist have to take x-rays to see decay? Well, a lot of the decay is in between the teeth. And so we can't even see it if we don't take an x-ray. The x-ray shows us that the decay is there. And if that's the case, we know we can get in early, take care of it. And if we do a filling, it can be relatively small rather than have to go in and do major treatment on that tooth. So every 6 months, you come in for an exam. We check your teeth for decay with the explorer on the surfaces of the tooth. And if we find something soft, we know that that's decay and we have to look a little further. We also take x-rays. A lot of patients go, I don't want x-rays. Do the exam without x-rays. Well, jokingly, that's almost like putting a blindfold on and let me just kind of feel around in your mouth and try to figure out what's going on. X-rays are so important because not only do they show decay, but they also show infection and they show bone loss and they show other forms of things that we're concerned about. So x-rays are very important. And we need to do that every 6 months, like I said, to stay on top of where things are, especially on younger folks. Teenagers and even younger children, sometimes decay can change drastically within 6 months. And a lot of that has to do with diet and just the normal genetics of that individual and how they deal with decay. But if you're having sensitive teeth, if you have sensitivity when you drink cold, or if you have pain when you're chewing, those are some things that we need to check on a 6 month basis.